policies to limit the spread of flu. Well, how does flu spread? Basically, with contact of the nose, mouth, and eyes with mucus droplets. And how do you get mucus droplets? Well, guys like this. Oh, there he is. We don't really want people to be doing this at work, but this is how these mucus droplets spread through sneezing, coughing. Here's his coworker sneezing right back at him. Or even talking. At a distance of 6 or even 10 feet, H1N1 can actually be transmitted. And these mucus droplets also wind up on surfaces. So although a clean desk is a sign of a sick mind, it may be a sign of a healthy body. So we do want to pay attention to not only our cough and sneeze hygiene, but also keep our surfaces clean. And perhaps our policies will include some things that we'll talk about in a moment in terms of personal hygiene issues and keeping these surfaces clean. So that's how it spreads. Now, what are we going to do to limit the spread? Well, again, to look at having a flexible plan that we can use right now in all cases, and then some other plans, severity and high severity instances. But first, let's just take a little break, and Ira will give you a screen where you can actually respond to this. And we'll cover all this material in a moment, but let's just take a poll, and I want to see what you come up with. Pick the answer that all of these methods are here to protect employees' health and safety, except we would like for you to pick which one is not a good method to protect employee health. The first one is reduce the number of face-to-face meetings that are held in the workplace. Or B, arrange workspaces so employees are at least 6 feet apart. Or C, allow flexible work hours so fewer people are working together at any given time. Or D, have all sick people working together in one section of the room. Okay, so we're going to let people answer the poll.
Okay, we've got about most of the people have voted. A few people are still
you guys
voting,
are quick.
So we'll give them another 20 seconds or so.
You guys are fast. Well, you're right. I guess you're paying attention. That's a good thing. Still a few laggers out there, Ira?
Oh, no. It looks like we got to 100%.
We got everything. Okay. How about that? All right. We'll give you the answer in a moment. But let's go through what are strategies that what policies can we put in place right now for all case severity? Well, one of the primary things is education and training of the employee workforce in things like basic hygiene. There are very good posters available from the CDC. In fact, we will send you links to this at the follow-up email session that you can post in different areas in your workplace if you haven't done so already. Very simple things like covering your cough, wash your hands, just these simple reminders for people to keep their hands clean and not spread those mucus droplets all over the place. There are some excellent online tutorials. This is a screenshot of one of them. This is an interactive tutorial on H1N1 flu, complete with little quizzes that we use in our antiviral programs. And it's very good information, cuts through a lot of the myths and really gives people good information about what H1N1 or swine flu is all about. And there are many other materials that we use just to get the word out about keeping the workplace free of mucus droplets and spread of flu. So, the personal hygiene promotion is one of the prime things that you can do, and one of the more relatively inexpensive things that you can do. You should be having lots of Kleenex or tissues and hand sanitizer throughout the facility. Some organizations give people these little personal-sized ones to keep in their workplaces, in their workspace, or pick up as they come into the facility every couple of days. Other folks put the larger pump buckets of hand sanitizer throughout the facility and encourage people to use them throughout the day. No-touch trash cans is another good strategy. This is where a lot of surface bacteria and viruses are picked up. So to have these around the facility is also a relatively inexpensive and effective strategy. If you haven't done a flu vaccine program, shame on you. We'll get you next year, but that's a very effective way to obviously reduce the spread of flu. Things like reducing handshaking. I don't know if this is where the fist bump came from, but I've heard tell that it's a good way to prevent transmitting both bacteria and viruses from handshaking. And we talked about surfaces before, and just having a policy in place to keep those places clean, perhaps not just at the end of the day, but throughout the day, including counters, doorknobs, railings, work surfaces, any surface where mucus droplets might collect. So these are things that every company can do relatively quickly and relatively inexpensively. Now, some of the high severity were when the flu activity has gotten severe, either in your monitoring of your own company's absenteeism or in monitoring the community activity. Different strategies can then be kicked in. Active screening of your employees when they come in by either a symptom survey, and again, the symptoms that we talked about were all the flu symptoms: body aches, chills, fatigue, cough, fever, runny nose, sore throat. So if you do a symptom survey and people have 2 or more of these symptoms, they might be referred to your nurse if you have one, or they might be sent home and say, these are flu symptoms, we want you to stay home for 2 to 3 days. Some companies will start to put in fever screening in addition to the symptom survey at the start of the work shift. Other things that we can do in a high severity scenario would be to close common areas where people gather in large groups, including lunchroom, cafeteria, or other common areas, to create what's called social distancing, keeping people less in contact with each other to transmit bacteria and viruses, flu virus. Engineering controls are something that take a little more planning and expense, things like sneeze guards or drive-through customer service windows if you have that type of business, and even to the point of creating negative pressure ventilation in areas, particularly in areas where there are a lot of people together. Using other devices like face masks or respirators might be something that you kick in when the severity gets higher. Face masks in the top part of the picture as opposed to respirators in the bottom. A face mask is basically your run-of-the-mill surgical mask that just prevents you from getting mucus droplets on your nose and mouth. Is the difference between a face mask versus a respirator, which can actually filter out a virus particle. The one on the bottom, picture on the bottom, is actually an N95 respirator. You may have heard of this, and that basically just refers to a filtering process versus just a mucus barrier in the surgical mask. So the respirator actually does take some amount of training and to use effectively. We talked a little bit about social distancing, less people working together, and this can be done by pulling people apart, but also by changing the hours that they work together, staggering shifts so there's not as much overlap, or even working from home if you have a telework policy, or you have the type of jobs that can be done on a computer or on a phone from home. Other ways are just to reduce face-to-face meetings by using technology that we're using right now, a WebEx or a GoToMeeting type platform. And other social distancing, we talked about having workspaces that are somewhat separated. So we want to go from this type of workspace, if this is what you have in your organization,